Welcome to Chapter 16, Reassessment for the Emergency Care 14th edition for the EMT. So in our reassessment, it's to repeat key elements of the assessment procedure already performed. We're going to identify changes and trends when we do a reassessment, and it should never be skipped when life-saving intervention prevents you from doing it. Except for when life-saving intervention prevents you from doing it. So what does it do? It identifies as changes, subtle and obvious, trends in our vital signs, deterioration and improvement. We're going to communicate with the patient, explain the process, consider the patient's feelings such as anxiety or embarrassment. You're going to repeat your primary assessment. So you're going to recheck for life-threatening problems, reassess the mental status, maintain an open airway, monitor the breathing rate and quality, reassess for pulse and rate and quality, monitor skin color, temp, and reestablish patient priorities. All of these things are going to be done every time you do a reassessment. It can be just as simple as a quick look over, check the vitals, check your patient, that type of thing. On a pediatric note, the mental status of an unresponsive child or infant can be checked by shouting with verbal stimuli or flicking the feet with painful stimuli. Crying is an expected response from a child with adequate mental status. So we're going to reassess and record vitals. We're going to compare those with the baseline measurements that we got in the beginning. We're going to reevaluate their O2 sat and document any kind of findings to record and identify trends. We're going to repeat parts of the history and physical exam. Has the chief complaint changed? Especially with regard to severity. Again, not that I'm a fan of that 1 through 10 severity thing, but it does help to identify, establish that baseline. So that way we can kind of determine whether or not the patient thinks that they're getting better or worse. Ask about changes in symptoms, especially ones anticipated because of treatments administered, and then repeat that physical exam. You're going to check your interventions, ensure adequacy of oxygen delivered and artificial ventilation if we've got it going, ensure management of bleeding. So if we've bandaged a wound or we've placed a tourniquet, we're just going to make sure that it's not continuing to bleed and that we don't need to apply more dressing to it. Ensure the adequacy of those interventions, of any kind of other interventions. So, observing trends. We're going to repeat reassessment steps frequently, notice and document trends. That trending is considered changes in patient's condition over time. Trends may indicate new treatments or adjustments to ongoing treatments as well. Reassessment for stable and unstable patients. So the patient's condition as well as the length of time with the patient will determine how often you reassess, and the more serious patient's conditions, the more serious the patient's condition is, the more often you will reassess. So when do we reassess? Every 15 minutes for a stable patient, every 5 for an unstable or potentially unstable patient. And if you believe there may be a change in the patient's condition, you want to repeat at least the primary assessment.